And you know, now I have two of my very favorite people to talk to. Dr. Jean Chamberlain, you are the founder of Save the Mothers. You're our partner this week, and we're here to support your amazing work.
Thank you.
And Dave Shelley, you are the director of Crossroads Relief and Development. You are the genius that recognized the value of her important work.
No, we've been looking behind the scenes with Dr. Jean at this issue, at the invitation of Dr. Jean, who some of our viewers will know and many of them will get to know during this week. It's such an important issue, and we can make such a huge difference. And when I was there, and of course you've been there, and I hope people will walk with us this week into some of these clinics and look at some of these issues, because I think it'll touch their hearts and we can make a difference. And we want to adopt and put some power behind the work that Dr. Jean's been doing to address more clinics and save more mothers' lives. That's the bottom line this week.
Well, I know you were so impacted when you were there. How many moms died in just the one weekend at the one hospital that you saw?
My recollection was it was about a dozen, 10 to 12 had died at one of the major hospitals on one weekend, and that's a tragedy, because with some practical solutions, from clean sheets to training for the staff, we can make a difference, and that's a sad state of affairs. But you know what? Things can change, and we'll do this program, adopt as many as we can, as our viewers support us, and expand beyond, start in Uganda, but expand beyond that into other countries in East Africa. So that we're looking forward to this week, and you walking us through, Cheryl, some of these places.
It's very exciting. You know, Dr. Jean, we're just starting to learn a little bit about the disparity between these two worlds, but you live in them. You're 8 months of the year, you live in Uganda, you see the conditions that women give birth in, and then you come here and you see how wonderful we have it, how blessed we are here. How do you manage those two worlds?
Well, it's interesting. I didn't really even realize the situation myself, Cheryl, till I went and saw it for the first time now about 15 years ago. And, you know, I think you realize that nobody in one place realizes what it's like in the other. In other words, the mother who comes into a Canadian hospital gets all the care that she needs. She doesn't realize that on the other side of the world, a woman basically never got to the hospital because she was waiting for her husband's permission in order to go, or if she got to the hospital, you know, there was no medicine available to care for her, or there was nothing there to help her baby if her baby wasn't breathing. Maybe there was no healthcare staff. So I think it's this really, we don't understand each other's world. It's almost like sort of like the weather in Canada. You know, we know what it is to be minus 25 degrees. When I share that with my Ugandan friends who have like their warm clothes on when it's 25 degrees out, I'm just like, you know, it's a total different world. So I think it's really helping people on this side of the world really understand the great needs in these places. And I just embrace whoever I'm talking to, and you know, try to help them understand what the other one is like.
Well, I know you had said to me yesterday, we were having lunch, and you were saying that you're talking to Dr. Eve in Uganda, and she's telling you about the 21 cesarean sections she just did, and you had just finished your 3 for the day.
That's right, exactly.
That's an incredible difference.
For sure, for sure.
Well, Dave, you wanted to take this on, and you want to expand it now to what countries, and why are we doing that?
Well, Ghana and Tanzania are on you know, Dr. Jean's radar, and so I mean the hard work has been done, which is there's a public health leadership program that Dr. Jean heads up. We have all of these advisors that want to be engaged at the local level and give advice and make improvements, and they just need the power of our giving to help launch them. So everything is in place. Everything has, like I said, we've looked at this for a few years, and everything is in place to really make a huge difference and give every mother that goes into that clinic a better chance at survival.
So basically what we can do is dependent on how people respond. We're basically just limited or not limited by how people respond this week.
I heard a wonderful saying yesterday, and is strong people stand up for themselves, but stronger people stand up for others. And what we're looking for this week is stronger people to come alongside and to lift these mothers and give them a safe experience with clean sheets and beds that they can lie on. They don't have to lie on the floor, and medicines that maybe the healthcare workers needed, and the training that they need, the extra training that some of these graduates and advisors can bring. That's what we're looking for this week. And you know, I encourage people to please walk alongside us as we take you into places that you didn't know existed.
Yeah, that's the response I got from the mothers when I talked to them. They had no idea it existed. Dr. Jean, this week, if you could dream about what would be the impact in East Africa moving ahead, looking into the future, what would you hope to see?
Well, as David says, we have trained people on the ground, Indigenous East Africans who are champions for maternal health. And so to be able to put the tools in their hands to actually go out and reach 40 hospitals in East Africa would be wonderful. And again, these are Indigenous people who are already living there, who understand the culture, who have been trained but need that extra level of training, and who also need the equipment. Like myself, I'm an obstetrician, but if you drop me in the middle of nowhere and I don't have the sutures, I don't have the equipment that I need to save a mother's life, I can't do the work that I need to do. So I think that's really what we're trying to do, is put the tools in the toolbox of these individuals who can then have an impact, because they are already there. It's not about us coming over and doing the work, it's about us equipping the people and the healthcare facilities through the Save the Mothers program. We're already there, we've been there 10 years, and we're already seeing a tremendous difference in the attitudes, the social, cultural issues that are behind the reason why mothers die. See, mothers don't die in Canada because we value mothers. Mothers cannot die in this country without there being a huge investigation, without us doing everything we possibly can to save that mother. That mother in East Africa, she dies quietly in her hut, bleeding to death because she wasn't valued. And that's really what the kind of change that we're bringing.
Yeah, we have to change that. You know, Dr. Jean, we're going to unpack so much more of this week, and I think people will be surprised to find the reasons why mom died. Like, you know, we think it might be something big, but sometimes it's so small.
That's right.
But, you know, we're honored to work with you, and one of the things we're really excited about for you is that you just received the Order of Canada. Congratulations.
Thank you very much. Thank you.
This is a beautiful award, basically honoring your work with mothers and you know, just the credibility of what you're doing, the way that you're bringing change, not just even equipping hospitals like you said, but bringing social and cultural change is so huge. What was it like to win that award briefly?
Well, you know, I love that verse, that they may see your good works and glorify your Father which is in heaven. And that's my prayer, that when people see that Order of Canada, they see the good works that all of us together are doing. And I can't do my work without the people also contributing. So we're all working together, that God may be glorified through the work that we all do together.
Well, thank you so much for your hard work and your vision. Thank you guys for coming on today. We will see you again this week, right?
Yeah.
Okay,
super.
wonderful.